Hello everyone, good evening one and all. Let us talk one more topic under biochemistry, that is investigations of diabetes mellitus. So what are the objectives of today's presentation? Importance of GTT. GTT is indicating glucose tolerance test. Then comes to types of glucose tolerance. We have mainly two types, oral glucose tolerance test and intravenous glucose tolerance test. Then types of glucose tolerance curve we are going to identify. In that, diminished glucose tolerance level, then increased glucose tolerance level. Then glucose tolerance test performed in specific conditions in diabetics, other extended glucose tolerance test, mini glucose tolerance test, and glucose challenge test. So let us talk about importance of GTT. GTT, glucose tolerance test. GTT is most important in investigation of asymptomatic hyperglycemia or glycosuria as renal glycosuria and elementary glycosuria. So what is the importance of this? It's an investigation can be preferable for asymptomatic hyperglycemia or glycosuria. Hyperglycemia, increasing of the blood glucose level. Glycosuria, identification of glucose in the urine. As renal glycosuria. Renal glycosuria means the problem is arising with the kidney. And elementary glycosuria, the problem is arising in the GI system. And this test may be contribute useful information in some cases of endocrine dysfunction. It is also helpful in recognizing milder cases of DM. Let us talk about regarding types of glucose tolerant test. The first one is oral glucose tolerant test. The second one is intravenous glucose tolerance test. Oral glucose tolerance test is also known as OGTT. Intravenous glucose tolerance test is also known as IV-GTT. So let us talk about regarding oral GTT, OGTT. So the patient who is scheduled for OGTT is instructed to eat high carbohydrate diet for at least 3 days prior to the test and come after an overnight fast on the day of the test. So we have to instruct the patient to have a high carbohydrate diet before the day of investigation, before especially at least 3 days prior to the test, and the person has to come for investigation overnight fasting. Then a fasting blood glucose sample is first drawn. So then 75 gram of glucose or 1.75 gram per kg body weight dissolved in 300 ml of water is ingested. First we need to draw a sample under fasting condition. Then we need to administer 75 gram of glucose according to his body weight, which is dissolved in the 300 ml of water is ingested. Blood and urine specimens are collected at half hourly interval for at least 2 hours. Blood glucose concentration measured and urine is tested for the glycosuria. A curve is plotted per time against blood glucose concentration and it is called glucose tolerance curve. So after blood glucose concentration is measured and urine is tested for the glycosuria. After that, a curve is plotted for time against blood glucose concentration. That curve is known as glucose tolerance curve. Let us discuss regarding the intravenous GTT, that is also known as IV GTT. The IV GTT is often used for person with malabsorptive disorders or previous gastric or intestinal surgery. Glucose is administered intravenously over 30 minutes using 20% solution. We know 5% dextrose, 10% of the dextrose, but in this condition we have to administer 20% of the dextrose. A glucose load of 0.5% gram per kg of body weight is used. Then comes to talk regarding types of glucose tolerance curve. Abnormal glucose tolerance curve may be due to with the two reasons. One is diminished glucose tolerance or increased glucose tolerance. The first we need to discuss regarding the normal glucose tolerance curve. Normal response to glucose load is as follows. Initial fasting glucose is within the normal fasting limits 70 to 100 milligram per percentage. Initial fasting glucose is within the normal fasting limits, that is 70 to 100 milligram percentage. Blood glucose level raised to a peak 120 to 140 milligram at half to 1 hour. After eating, blood glucose level will be rising to a peak approximately 120 to 140 milligram percentage at half hour to 1 hour. The blood glucose level then returns to rapidly to the fasting normal limits in about 2 hours. After 2 hours completion of our food, our blood glucose level try to be decreasing. Glucose should not be present in any of the urine specimen collected for 2 hours. The glucose tolerance curve, when we talk about the glucose tolerance curve, we have to notify. So how the graph is plotted? The graph is plotted time and we have to notify the raising of the blood glucose level. So in y-axis you can notify blood glucose, that is measured in the milligram per deciliter, and then x-axis it is plotted in the hours. Then the picture A is denoting a diminished glucose tolerance occurred in diabetes mellitus and endocrine hyperactivity. So here we notifying the sudden raising of the blood glucose level and gradually decreasing of the blood glucose level we are going to be notifying. So that in this can be occurring in the cases of renal threshold. Then normal, the second picture B picture we can notify, it is denoting as a normal. So it is suddenly rising, after that it is try to be gradually slowing to the, and it is also showing like normal means plotting flat curve we are going to be notifying. And third picture, that is increased glucose tolerance, for example in endocrine hypoactivity. So small raising we are going to notifying, after that abrupt change gradually decreasing we are going to be notifying. There is no, in the when we comparing the first middle picture and this A picture and C picture, we can see different kind of changes in the glucose tolerance curve. So let us see here, what is the meaning of this diminished glucose tolerance? Diminished glucose tolerance means decreased ability of the body to utilize glucose. Our body is failure to utilize our glucose. In diminished glucose tolerance, fasting glucose is higher than normal limits. So fasting glucose will be notifying as a higher than the normal limits. The blood glucose level raises above 180 milligram per 100 ml. This is because of the renal threshold after ingestion of glucose. The blood glucose remains high for a longer time and may not return to fasting level even after 3 hours. So what do you mean by renal threshold? The concentration level up to which a substance in the blood is prevented from passing through the kidneys into the urine. So the concentration, once again we can discuss regarding this concept, the concentration level up to which a substance in the blood is prevented from passing through the kidneys into the urine. So urine will not be filtered until some extent, then it becoming as if the concentration level of the glucose is going to be increasing. Then the urine samples corresponding to blood glucose level over 180 milligram per 100 ml may show urine Benedict test positive, that is known as glycosuria. I told you regarding in previous classes what do you mean by glycosuria? Presence of glucose in the urine is known as glycosuria. Diminished glucose tolerance occur in diabetes and certain endocrine disorders as hyperthyroidism, hyperpituitarism, hyperadrenalism. This hyperadrenalism also known as Cushing syndrome. So what do you mean by Cushing syndrome? Or it is also known as hypercortisolism, which occurs due to abnormally high level of hormone cortisol. Then let us talk regarding increased glucose tolerance. So increased glucose tolerance means increased ability of the body to utilize glucose. In increased glucose tolerance, FBS means fasting blood sugar is lower than normal. Only small raise in blood glucose level may be observed, not greater than 100 milligram percentage, even after glucose administration. So in this condition, what is happening? Our body utilizing more glucose. That's why in the blood, the glucose level may be observed not greater than 100 milligram, even after glucose administration. A flatter type of curve is obtained. So no appearance of glucose in the urine. So this type of curve is obtained in endocrine hypoactivity as hypopituitarism. This is also known as myxedema and cretinism. Hypoadrenalism. This is known as Addison's disease, and hypopituitarism. Addison disease. What do you mean by Addison disease? Insufficient hormones from the adrenal gland as cortisol, aldosterone. Cortisol. What is the importance of the cortisol? Cortisol increases the availability of the blood glucose to the brain. Then aldosterone, which affects on sodium, increase causes the body to retain water in blood, which increase the blood volume. Then glucose tolerance test performed in specific conditions in diabetes. Glucose tolerance test performed under special conditions are extended GTT, mini GTT and GCT, that is known as glucose challenge test. Extended glucose tolerance test. Extended GTT is a OGTT extended to 4 to 5 hours. Extended. It is meaning extra time taken for measuring of the blood glucose level, approximately 4 to 5 hours. It is performed to diagnose the cause of hypoglycemia, especially which occurs 2 to 3 hours after meal. This is known as reactive hypoglycemia. Reactive hypoglycemia, after feeding state also, our blood glucose level will remains very normal range, not in the normal ranges, below the normal. That is why we consider here it's a reactive hypoglycemia. Do you understand this? After eating condition or after fed condition, our blood glucose level below the normal levels. So that type of condition is known as reactive hypoglycemia. Reactive hypoglycemia produce hypoglycemia in the postprandial fed condition. Postprandial means after eating. Extended GTT may not be useful in fasting hypoglycemia. Extended GTT is carried out following a minimum 10 hours of fasting with only water permitted. 75 grams of anhydrous glucose dissolved in 300 to 400 ml of water is orally administered. Blood samples for glucose, plasma cortisol and growth hormone are collected at 0 and 30 minutes intervals for 5 hours. Most normal subjects show a rise in the blood glucose followed by a fall to a baseline at 2 to 5 hours. Blood glucose of 45 mg per dl and rise in blood cortisol and growth hormone levels occur with reactive hypoglycemia. Then the next one is mini glucose tolerance test. As per current recommendations of WHO, World Health Organization, in mini or modern GTT, only 2 samples are collected. So that is the first sample in the fasting time 0 hour, second sample 2 hour post glucose load. Post glucose load means after administration of the glucose after completion of 2 hours. Urine samples are also collected during the same time. The diagnosis is made from variations observed in these results. The third one is glucose challenge test, that is GCT. The glucose challenge test measures body response to sugar or glucose. The glucose challenge test is done during pregnancy to screen for gestational diabetes. Gestational diabetes is the diabetes that develops during pregnancy. The test is generally done between 24 and 28 weeks of pregnancy. So what is the procedure here? After arriving a laboratory, about 150 ml of glucose solution that contains 75 gram of sugar is given orally to a pregnant woman without regard to the time of last meal. A venous blood sample is collected 2 hours for estimating plasma glucose. Result of the glucose challenge test are given in milligram per deciliter. Gestational diabetes is diagnosed if 2-hour plasma glucose is 140 mg per deciliter or higher. A blood sugar level below 140 mg per deciliter is considered normal. Let us summarize our topic. So far we have discussed regarding importance of GTT. GTT is indicating glucose tolerant test and types of glucose tolerant test. Mainly we having two types: oral glucose tolerant test and intravenous glucose tolerant test, and we have notified regarding types of glucose tolerance curve, in that diminished, in which cases glucose is going to be diminishing and which cases glucose is going to be increases. Then we have discussed regarding glucose tolerant test performance different conditions, that is like extended glucose tolerant test, mini glucose tolerant test, glucose challenge test. This glucose challenge test also recorded as a GCT. I hope, my dear students, we understood this topic on remaining the investigations under diabetes mellitus. I hope you understood well. Thank you once again. We meet you once again. Have a nice day.